Well, good afternoon, everyone. Bonjour à toutes et à tous. Welcome to Toronto. Is everybody having a great time in the big city of Toronto? Thank you very much, President Carol Timmings, for the introduction, and of course to you, Dr. Grinspan, the entire Board of Directors, and all of the chapter presidents for your leadership and for your advocacy. It's great to be here. My speech says it's great to be here with my Deputy Leader, Jagmeet Singh, actually. And of course, Jagmeet Singh is not here yet. And when Carol asked me when I arrived, should we wait for Jagmeet? I knew then that she doesn't know Jagmeet very well, because we might be waiting an awful long time. But he will get here because he usually does arrive, but just sometimes not at the appropriate moment. But he did. I was just sitting beside him in the legislature, so I know it's his intention to be here. But I didn't want to delay the rest of the afternoon by waiting for him. And you can tell him I said so. He won't be insulted. It's a characteristic of his that we like to poke fun at, and he's okay with that. Look, the RNAO is such a strong voice for the nursing profession, and I have to say, having been leader now for several years, I've come to appreciate more and more the work that your organization does. You're a real leader for health public policy across Ontario, and I look forward to meeting with you and your representatives every chance that I get. Whether it's back at home in Hamilton for Take Your MPP to Work Day, or when I sit down with nurses in roundtable discussions around the province and places like London and, oh my goodness, Windsor and Sioux Lookout. And I mean, we've been doing this work for a long time, having discussions with the people on the front lines who know what's happening in the healthcare system. And what do they tell me? They tell me they're working long hours in crowded emergency departments. In Sioux Lookout, when I met with Carol Maxwell and Patty Dasno, and I think Carol might actually be in the room. Hi, Carol. Maybe Patty's in the room. Is Patty in the room today? No. We talked about the urgent need to do more to take on diabetes, tuberculosis, and sexual assault in every corner of our province. I always appreciate our conversations about the change that we need to build in order to build a healthier future here in this province. On partage les mêmes valeurs. On partage les mêmes priorités. Ensemble, on partage la même vision. Everyone who goes into nursing has a pretty big heart. When you see people suffering, you want to help them. In fact, this is a profession built on compassion and built on the unwavering principle that great care is for those who need it, not just those who can pay for it. So nurses and New Democrats have a strong bond because we are all driven to build a better future where no one is left behind. We all know that we live in a great province. We have a lot of strengths in Ontario. Our hospitals have been world-class in providing care thanks to the work that you do. Our community health sector is critical to taking down the barriers that people face, and we pride ourselves on having great universities where young people can study hard and become the next generation of RNs and nurse practitioners. And at the core of who we are as Ontarians is our deep belief in the importance of community and the idea that we are all better off when our neighbors are better off too. That belief in care and compassion gives our province so much potential to do great things. But in spite of our strengths, we're facing big challenges, and we have to take them head on. There are First Nations communities living without fresh water and without proper access to health care or properly equipped and staffed nursing stations in the year 2017. It's just plain wrong. We've got to fix it. Many of our aging parents and grandparents are struggling to get the home care and the long-term care that they need. They're waiting far too long for care that they need now. We've got to fix that. We have schools being shut down because the province isn't funding our children's education. And thousands of parents are fighting tooth and nail to make sure their kids aren't stuck for 3 hours on a school bus every day. We've got to fix that. And the biggest challenge for a lot of people is that costs keep going up, but wages are flat. And that's making it hard, making it harder to build a good life here in Ontario. Young people are living with the huge burden of student debt, and millions of people are stuck in low-paying jobs, jobs without security, without benefits, and without the opportunity to get ahead. We've got to fix that. We're at a tipping point in Ontario today, and you see the health impacts of that each and every day. People who need mental health care and supports should be able to get it, not fall through the cracks. People who need prescription drugs shouldn't have to choose between food and the medication they need, just because they can't afford both and don't have any health benefits at work. And every First Nation in Ontario needs access to the clean water, safe housing, and proper health care that every Ontarian expects. Frankly, that's what reconciliation will look like in people's lives. For millions of people across Ontario, the status quo is no longer an option. If we don't make bold changes, we're putting people's future at risk. And the next generation won't have the opportunity to build their future right here in Ontario. We need change. And excuse me if I sound a little bit partisan, but I don't believe that returning to the failed conservative ideas of the past is the change that we need. We don't need tax cuts for the rich, thank you very much. We don't need more corporate giveaways to the wealthiest companies. We don't need more privatization, like the sell-off of Hydro One and the sell-out of control over our hydro rates. And we don't need more for-profit medical tourism and privatization in our healthcare system, which the RNAO has done such a great job of standing up to. Thank you for that work. The change we need in Ontario today is change that moves this province forward and makes everyone better off. Change that makes our communities stronger, gives people security in their lives again, and gives young people the opportunities they need to build a great future right here in Ontario. Look what's happening in healthcare. The hospital cuts have been so deep, there's nothing left to cut except the care that people count on. 1,500 nursing positions cut in the last 2 years, gone. That's 1,500 hardworking, dedicated, and compassionate nurses who should be providing care for patients. And that's just not right. Fewer nurses never means better health care. Never, ever does fewer nurses mean better health care. In Windsor, our Ontario-educated and trained nurses are being hired up by hospitals in Detroit, not here at home. And then when your former president, Vanessa Burkowski, dared to speak up, we know what happened. In fact, when I saw you in the chamber today, Vanessa, I just wanted to run over and give you a hug and say, I hope you're doing okay. I'm sorry?
Vanessa, for being courageous,
yes,
was picked up quickly by another hospital
good.
that had better leadership.
Very good, right? Very good. Vanessa was picked up by a hospital that had better leadership. Very, very good. But when she was fired, and we all remember that, it was New Democrats that stood up with all of you, and we actually called for an external review. We have freedom of speech in the province of Ontario. We stand up for the things that we care about, and we support the people that stand up with us. We stand up with nurses, we stand up for nurses, and together with you, we stand up for people and the high-quality care that they need and that they deserve. After so many years of cuts inside our hospitals, it's time for a complete moratorium on any further nursing cuts. Rather than eroding your profession, we should be helping nurses to provide great care. We have to work to increase full-time employment for RNs. And we have to make sure that every nurse and nurse practitioner can finally work to your full scope of practice. Now, I understand that the minister has made some announcements today. I have to tell you, it's not the first time Liberals have made announcements. It's not beyond Liberals to make the same announcement every year for 4 years running. Having said that, you know the New Democrats are with you when it comes to a number of the issues that you've been advocating for, and I'm going to touch on some of them now. You know, of course, our critic, my colleague France Gélinas, our NDP health critic, is the biggest champion at Queen's Park for nurse practitioners. And like all of us, she knows how important nurse practitioners are, especially in small and northern communities, where you're the only primary care provider in town. And France is going to keep working to get rid of every barrier that stops nurse practitioners from helping people. Nurses have to be empowered to provide great care to more people. That's what this is all about. The quality of patient care is my bottom line in healthcare. Now, again, if the minister chooses to make some moves on this front, the New Democrats will be there with you, making sure that the moves are in the right direction and that they provide the kinds of opportunities that we know nurse practitioners need in terms of their scope of practice. You know, the bottom line of patient care is the guiding principle that should steer any government's decisions. It should always be about patient care. And that's, in my opinion, what's been missing all too often with the current government. After 4 years of frozen hospital budgets, emergency department wait times are longer today than at any point in the last 9 years since wait times started being posted. Patients are being treated in hallways, as those ALC rates also soar. And I talk to women and men who are waiting not just months, but years for the surgeries that they need. We need to change that. So let's do something about it. Instead of starving hospital budgets and cutting patient care like the current government has done, we need to guarantee that hospital funding will always keep up with growing costs, like inflation, population growth, and the unique needs of our small towns and rural and northern communities. That's the baseline guarantee that people need, and that's exactly what New Democrats are fighting for. Hospital care must be protected. At the very same time, as we fix home care. We can't pick and choose. We have to do both. When any one of us needs care, we would all prefer that it be provided in the comfort of our own home. But right now, home care is full of holes. If you're from Eastern Ontario, you might have heard the story of Rose back in December. Anybody here from Eastern Ontario? Remember the story of Rose? Rose was a wonderful, loving 78-year-old woman in Ottawa. And she spoke out publicly just a few days before she passed away. She needed palliative home care in the final days of her life. But she couldn't get all the care she needed because this government's funding simply has not kept up with the huge need for home care. What happened to Rose and her family should never happen in Ontario. People shouldn't be left to suffer, not at the end of their lives, not ever. We have to step up and build the best home care system in the entire country. Wait lists have to be eliminated. People need a guarantee that they'll get the care that they need. We have to make every job in home care a good job so that nurses and PSWs can provide great care. And this is something that separates New Democrats, I think, from the other two political parties, we have to do much more to support public and not-for-profit home care so that funding goes to care, not just to private profits. That's the change we need, not just merging CCACs into LHINs, and I know you worked hard on that issue, but bold change to make sure a real difference occurs in people's lives, because families cannot wait any longer. And speaking of waiting any longer, Jagmeet Singh has now arrived in the room. Stand up. Jagmeet Singh, the Deputy Leader for the Ontario NDP. In so many ways, we've seen what happens when the government waits. The problems grow. And it's so disappointing to see the current government letting people down on issue after issue in healthcare. It's frustrating to watch as people suffer. We've seen it with the fentanyl crisis, which is hitting our communities hard, and the fact that it took this government 6 long months, 6 months too long, to give the green light to the City of Toronto to open supervised injection sites, even though all public health evidence shows that supervised injection sites will save lives. It's taken way too long for this government to do the right thing in the face of a national crisis. And it's the same on so many issues, where we hear good talk, but don't see action. Think of the urgent need for universal national pharmacare, the unfinished business of building Medicare in this country. Aujourd'hui, il y a trop de familles qui n'ont pas d'assurance. Trop de familles vivent dans l'anxiété. L'anxiété. Sorry. In fact, 1 in 3 working people in Ontario today does not have employer drug coverage. And that goes against the very idea that we teach our kids. The idea that if you work hard, you'll have security and be able to build a good life. No matter what you do, no matter who you are, you should have drug coverage. So let's not just talk about it. Let's make it happen. Ontario must lead on national pharmacare, not just with words, but with action. And we shouldn't stop there. We must lead the way on improving all of the social determinants of health. Good health, as you all know, is about more than just healthcare. We always have to think upstream. And I applaud the RNAO for looking at the big picture and bringing the holistic vision of what good health really means. As nursing leaders, you know how to help your patients heal. Nurses do it very well every day. But if your patient is going back to unsafe housing, or has a part-time job and can't afford healthy food or prescriptions, or going back to a First Nations community without fresh water, we all know what their health outcomes will be. Band-Aids are not enough. We have to improve the social and environmental determinants of health and make real strides towards health equity for every Ontarian. We need bold change to tackle climate change, to make polluters pay, and to clean up the mercury in Grassy Narrows that is hurting so many people in that community. We need bold change that restores provincial funding for public transit operations across Ontario, like the TTC here in Toronto, but every other community as well. That's funding that Mike Harris and the Conservatives cut, that has never been restored. And we need bold change to raise the minimum wage to $15 an hour. They're doing it in Alberta in Alberta, and everyone knows the economic challenges that Alberta has been facing over the last couple of years. But in Alberta, under the leadership of Rachel Notley, they are raising the minimum wage to $15 an hour. They're doing it south of the border, in New York, and in other cities and states. And they're not going to let Donald Trump stand in the way. Ontario should be a leader too. But as those of you who were in the legislature this morning saw, the Liberals are fighting New Democrats on this issue. They are dead set against a $15 minimum wage, and they're making every excuse in the book to justify doing nothing to help working people. Do you know that it'll take to close to 2030 with the government's current formula for minimum wage increases? Today, when we asked that question in the legislature, they talked about the fact that they've raised the minimum wage 9 times since they've been in office, and that they do that regularly now. But based on inflationary increases, right? Changes to the CPI. But I mean, if you're raising the minimum wage based on the CPI, but the wage that you're using as the base wage is a wage that keeps people in poverty, all you're doing is guaranteeing that you're keeping people in poverty for year after year after year. By the time 2030 comes, the minimum wage certainly needs to be much more than $15 an hour, and yet that's what the Liberal government plan is. Every single day that the Liberals refuse to act, we know what it means in people's lives. Hundreds of thousands of people in London and in Sudbury and in Niagara Falls and right here in Toronto and in all of our communities are working hard but stuck raising their kids in poverty. That's what it means. For the sake of every one of those children and every one of those families, we need to raise the minimum wage to $15 an hour. Every job should come with decent pay and benefits and the security that people need. And no child should grow up in poverty in a rich province like Ontario. No working family should be stuck living on the edge. Not in Ontario, not in the year 2017. Now is the time for change. And as you go back to your communities across the province, I know you'll continue to champion the care that people need, the dignity that seniors deserve, the strong public services that our children and our communities are counting on, and the progressive change that this province still needs. You are the champions for a better future in this province. And I want you to know that New Democrats share that very same vision. We are inspired by the